Hello, everyone, and welcome to this week's episode of Unleashed. Miracles happen, I should know. 3 years ago, amidst COVID quarantining, Regent Zoom calls, and considering a run for governor, I got a nagging headache behind my ear. The dentist was convinced it would be solved with a root canal or a new crown, and the chiropractor felt it would fade with an adjustment. My doctor was cautious but not worried. My family thought it was just plain old stress. All good possibilities, but I had a feeling that something wasn't quite right, something bigger. Fortunately, I was blessed with a doctor who trusted me, believing this needed a deeper look. It was scary, but I wanted to know. I didn't want to live with the unknown. And a day after listening to the knocking MRI machine, a phone call knocked the wind out of me. I had a brain tumor. Not cancer, but a serious brain tumor that would take my life if I didn't have it removed. 3 weeks later, I would be wheeled into a very bright, cold operating room to have it removed with a craniotomy. Over those 3 weeks before the surgery, I experienced a lot of highs and lows. You hope for the best, you prepare for the worst. Perhaps my greatest fear came when the neurosurgery resident introduced himself with a Nebraska Cornhusker lanyard hanging around his neck. Well, the Buffs fans will get it, but I'm kidding, kind of. After surgery, I woke up with a sense of gratitude that I will never forget. I was okay. I would take my kids to their proms, their graduations, welcome my grandkids. I was blessed, so blessed to be in the care of some of the best doctors and best nurses, all trained in the best place to live on earth, America. I think of the technology that diagnosed me in a single day. I think of the doctor's steady hand, leaving my brain intact, with just a bare minimum of the tumor left, with no future worries, no effects, and an insurance company that built the model to make sure that I didn't have to pay much for this multi-$100,000 surgery. It's not perfect, but darn it if it didn't work miracles in my case, the whole system, as it does for so many. We are all blessed to live in America, home to one of the top medical systems, and in Colorado, one of the top medical schools and teaching hospitals in the country, CU Anschutz. We're blessed to have robust healthcare insurance options, at least for now. From the heroic efforts of nurses and doctors on the front lines to the extraordinary accomplishment of researchers developing important treatments, our healthcare is unmatched. Now, not that any of this is a surprise. Since I was elected regent in 2016, I was able to oversee firsthand CU Anschutz, which is one of the 4 campuses that we have oversight as a regent. The doctors, the nurses, the researchers, and the donors were all doing nothing short of miracles, curing cancer, Alzheimer's, and diabetes. It was amazing. It is amazing. But unfortunately, all this is changing because of some bureaucrats who decided to get in the way of this amazing system. In the midst of the pandemic, Colorado's legislature pushed through a little talked about state-controlled plan that would majorly impact the delivery of healthcare services in Colorado. This is pushing the system that created my miracle, that creates lots of miracles, one of the top-rated systems in the country here in Colorado, to a breaking point. So why are some elected officials so eager to change things and put the government in charge? My brain is recovered enough to loudly proclaim, "Don't! Get out of the way! Stay out of it!" While the Colorado affordable healthcare option is not the broad solution that our politicians claim, imagine that. With unintended consequences to quality and access, it may force our system to eliminate some very critical care functions and skyrocket costs. It may even endanger miracles just like mine. Colorado's public option that was passed is failing to deliver on its promise to make healthcare more affordable, with Colorado facing Rocky Mountain high premium increases. Advocacy groups said the bill would bring more affordable and equitable insurance options to Coloradans by reducing costs on a standardized plan structure that provides lower out-of-pocket costs, deductibles, and copays. That's their words. Well, in reality, health insurance premiums in the individual market went up 10% this year, which is the law's first year in effect, and are expected to rise again next year by a good amount. Since implementing the Colorado options, several insurers like Bright Healthcare and Friday Health have had to leave the exchange market, resulting in thousands of people in Colorado scrambling for new insurance with fewer options to choose from. This is not the intention. Imagine that, good intentions. What do they say? So far, only 1/3 of the individual plans and 80% of Colorado option plans on the small employers market are hitting the state's targets. That's from the Colorado Sun. Colorado's healthcare future, which opposes the law, it's a group, called it a broken promise that is only leading to higher prices and less competition. And a recent analysis demonstrates how the state government-controlled health insurance system is increasing costs for Colorado and reducing competition in the state's health insurance market, the exact opposite of what we want to happen. They commented that in plan year 2023, consumers in most counties would be able to achieve more premium savings by shopping on the free market for the lowest premium plan rather than selecting a Colorado option plan, which is generally not the lowest premium plan available. They also found that Colorado option-related restrictions will make it very difficult for the Colorado market to attract new issuers to participate in the individual or small group Affordable Care Act markets. Bye-bye free market in the healthcare system in Colorado. Guys, is now the time, with rising inflation and affordability out of reach for most folks, to just live our day-to-day lives, to pile on more regulation, more government control, seize upon a crisis to boost state power? Is now the time to strangle those free market heroes who served us so bravely the past few years in the healthcare space? Is now the time to put future miracles at risk? Absolutely not. No human system is perfect, but Colorado's healthcare truly is a miracle. Just ask my kids, ask my husband, ask me. My personal journey through a brain tumor and brain surgery, a health scare that highlights the importance of preserving the free market aspects of our healthcare system. The Colorado Affordable Healthcare Option, with its state-controlled approach, threatens to disrupt the balance that has allowed for high-quality care and innovation. And while it promises affordability, the reality is that costs are on the rise, and the unintended consequences of this approach may lead to decreased access and quality of care, and of course, skyrocketing prices. Governor Polis and the Democratic leadership here in Colorado are on a mission to lead our state towards universal health care or socialized medicine. Don't let them tell you any differently. They've even taken a unique step by providing state subsidies, otherwise tax dollar payer money, to undocumented immigrants for their healthcare needs. This at a time when most Colorado folks can't afford their healthcare that are citizens. In Colorado, we've set aside an annual budget to offer state aid, taxpayer dollars, to around 11,000 undocumented residents. The response to this initiative has been so overwhelming that last year they reached the enrollment cap in just about a month, and this year it happened within a mere 2 days. You know, this high demand is going to lead our Democrat politicians to allocate more of our tax dollars to meet the growing needs of the illegal immigrants in Colorado. Now, while the prospect of nationwide insurance subsidies for undocumented individuals has its challenges, it still can happen in states like California and now Colorado. California has already taken the steps to make Medicaid accessible to illegal immigrants. And through such initiatives and others, they are gradually pushing the U.S. closer to the goal of socialized medicine. And Jared Polis is on board with that effort and pushing just as hard behind the scenes. In contrast, a free market approach to healthcare combined with a direct primary care model can offer a viable solution to our healthcare challenges. It works. We know it works. So here's how I propose we fix healthcare in Colorado. Number one, we go back to embracing free market principles. Instead of relying on government control and regulation, we should encourage competition among healthcare providers, insurers, pharmaceutical companies. A competitive market can drive down costs and improve the quality of our care. Number two, we should grow a direct primary care model where patients pay a monthly subscription directly to their primary care physician outside their insurance. You can get major medical with it, but outside the insurance. It enhances the relationship between patients and their doctors. It ensures more accessible and personalized care, and it reduces administrative costs associated with insurance billing. I use one, and it works. Number three, we should remove barriers to entry. To promote competition, we should streamline license requirements for healthcare providers, make it easier for new entrants to join the healthcare market. and just free up the system to do its magic and reduce costs. This will increase choice for consumers. It'll put downward pressure on the prices and make for a better healthcare system for all of us. Number 4, transparency. We must promote transparency in healthcare pricing to empower patients to make informed decisions about their care. When patients can easily compare prices for medical services, they can choose the most cost-effective options, driving competition among providers. Number 5, we need more robust patient education. We need to educate the public about their rights and about their options in a free market healthcare system. This is essential to making all of this work. Patients need to understand how direct primary care works and the benefits it offers in terms of cost savings, access to care, and personalized treatment. Same with picking a provider for an MRI or a surgery. Same thing. Number 6, we need continuous monitoring. We need to establish a non-governmental group responsible for monitoring the impact of these changes. That's crucial. Regular assessments will ensure that the free market approach is effectively reducing healthcare costs, improving access, and maintaining or enhancing the quality of care. And finally, we need to preserve the miracle. Colorado's healthcare system has achieved remarkable results, and we must not jeopardize it with hastily implemented, state-controlled, bureaucrat-led plans. Instead, we should focus on preserving the aspects of our healthcare system that have worked and seek innovative free market ways to improve it further. To wrap up, my personal experience with a health scare has reinforced the importance of preserving the free market principles that have contributed to the success of Colorado's healthcare system rather than hinder it. While the Colorado Affordable Healthcare option may promise affordability, it risks disrupting the delicate balance that has allowed for high-quality care and innovation. By embracing a free market approach, promoting direct primary care, removing barriers to entry, ensuring pricing transparency, educating patients, and continuously monitoring outcomes, we can fix healthcare in Colorado and continue to provide the miracles that our state's healthcare system has been delivering, including my own. So our guests today are healthcare professionals on the front lines of innovating a new healthcare future in our state. First off, Dr. Kelly Shockley is a remarkable practitioner based in Centennial. Kelly takes an innovative prevention-based approach that is all about you as an individual. She's wonderful. I'm a client and I've been so impressed. It's changing the way I think about my own healthcare. We also have the privilege of sitting down with Dr. John Dygert, a family medicine physician based in Colorado Springs that is the visionary behind Pinnacle Advanced Primary Care, a direct provider model, just like I was telling you about. I'm a client of Pinnacle as well, and it's worked wonders. It saved us money as a family. It's given us a more intimate relationship with our provider and allowed us to control more of our healthcare decisions. I'm so excited today to welcome a dear friend of mine, Dr. Kelly Shockley, who has changed the way I look at healthcare and how our family addresses healthcare. And I wanted her to tell us a little bit about, of course, her background and how she got into this industry and how she's doing things differently, shaking things up, but also about how we can do that as consumers and shake up the industry and do things different and keep our kids and our families healthy. So Kelly, welcome to the show. So happy to have you.
Thank you so much, Heidi. This is just going to be so much fun to get to be here, so I appreciate it greatly. So how did I get here? My story goes way back to actually before I was in high school. I was a super sick kid, and I was being passed all around the medical system, and nobody knew what was wrong with me. I went to every specialist under the sun, had all kinds of different testing done, and had been medicated for what they were calling chronic sinus problems, sinusitis, for 5 years straight by the time I was a sophomore in high school. And at that time, I was on 6 medications. I was alternating half days of school because I would get migraines that were so intense that if I stayed longer than a half day of school, my vision would distort and like words would pop in and out of pages, so I'd had to go home. And we're approaching Christmas break, and the last specialist I saw was an internist. And he's like, well, we're gonna change up your antibiotics again. And so I was on 2 more potent antibiotics and a mucus thinner and a decongestant and prednisone, which is steroids. And I was on steroids all the time, which is terrible for anybody, much less alone a growing, developing teenage girl.
Yeah.
And I was on actual painkillers because of my headaches. And so he's like, we're gonna change this up, and then when you come back from Christmas break in 2 weeks, if you're not any better, then we should try antibiotic, like IV antibiotics. And if that doesn't take care of it, you should have sinus surgery. And all throughout this journey, nobody could tell me why I was sick. And they just kept like, well, we'll try this and see how it goes. And we'll try this and see how it goes. And nothing was working. It was just getting worse. So thankfully, we were going to Arizona for that Christmas break. And my grandfather wintered down there. He was having back issues. So one of his brothers in Nebraska was like, you need to go see a chiropractor. So he started seeing a chiropractor, just opened up the yellow pages. Remember when we had those?
Yes.
And picked some random name out of the book, which at the time we had no idea. He's been one of the most pivotal chiropractors in our profession, has really helped pave the way. And he went to see him, was getting good success, started talking to him about me, because this chiropractor didn't just work on neck and backs.
Mm-hmm.
And so when we went down there, I practically lived at this guy's clinic for like 5 hours a day. It was a multidiscipline, alternative clinic. And for the first time, the questions he was asking, like nobody had ever asked me these questions. And then he did all kinds of different types of tests that had never been done before. Like there was a gal there that drew my blood and then looked at it underneath a microscope, dark field microscopy, and could tell me all these different things. And he asked me questions like, how were you born? No medical doctor ever asked me that before. And when we got through this whole process of him evaluating my situation, he's like, I think I know what's going on here. And my family was like, wait, what? And so he kind of filled us in on here's how I'm connecting all of these dots from how you were born to what you've been dealing with and how you've been being treated. And what he really was spelling out for me that I had never heard before was that there's a very big difference in just managing symptoms versus actually finding the underlying root cause of a problem. And so I was in because it was miserable, and I was a teenager that looked like I was pregnant at times because my gut was a mess, and I had weeping wounds on my face because my skin was so messed up and just was miserable. And like, tell me whatever you need me to do and I'll do it. And so we followed his protocol. We changed up my diet. I was off all the medication in less than a week of being there. Not that I felt amazing. Went on a lot of different nutrition to start feeding my body. In less than a year, was a totally different person.
Oh my goodness.
So I knew I wanted to be a doctor before that, but he opened my eyes to this whole entire different approach that we had never known before of how you can actually help patients. So it was at that point in time that I knew I was going to become a chiropractor. So that's what started this whole process, and he's the one who opened my eyes that there's really a different way to look at somebody's health. And then that's what I've spent the last 19 years doing, is viewing health differently and finding the underlying cause of a problem for somebody and addressing that versus just managing symptoms.
Well, and Kelly, chiropractic's part of what you do, but you do so much more, and you do so much investigative work into our health and like what's going on, what our lifestyle is, what our habits are. Talk a little bit about how you expanded your practice and your view into other areas of health diagnosis and treatment.
Yeah. So the chiropractic school was supposed to have all the answers for me, and I wanted to know what Dr. John Brimhall knew. And so I went to chiropractic school, and I got out and I still was like, but I don't have clarity and certainty on how do I really determine where a cause of somebody's problems are. And there was all different types of techniques, and not saying that any of these are necessarily wrong or bad, but like being able to do muscle testing through applied kinesiology, like, okay, well, cool, but that's not black and white for me. The different, like billions of difference of supplement companies out there, everybody had like symptom surveys. Like, we can't do things off of symptoms. I have patients even still today that are like, yeah, this is what's happening with my gut. What do you think I need to do? And like, there could be a bazillion different reasons why your body is manifesting these symptoms that if I don't have a definitive way to evaluate, then we're not going to know. We're just really playing Russian roulette. So I went through this whole journey of learning more and investigating more and just trying to get my hands on something that was credible, that was objective, that was easy to understand. And another amazing human that actually Dr. John brought into my world Dr. Merkel, he was actually in Arizona, and I went to one of his lectures. And for the first time, like in chiropractic school, we do all the same medical classes that medical students do. Mm-hmm. And we just, our hours are weighted a little differently. So we had done lab work, clinical pathology. We even were drawing each other's blood once a week. And it was still a very foreign concept to me. So what I learned through Dr. Merkel was just an entirely different way to view the labs that we had available to us, which is gold standard. Like your medical doctor will run labs on you. They're very limited in what they can do. But for the first time, I had a different way to actually interpret the results that were there and to know exactly what I needed to test to evaluate you as a whole. Mm-hmm. In my opinion, based off of what I've seen and what I've learned and the research that I've done, you have a foundation to your health. And it's more than just your gut health. It's more than just brain health. It's not just one system inside of the body. Mm-hmm. The foundation of your health, it's all of the major, critical organ systems. And so through this journey and how I expanded, like once I found this, I had such confidence that now I can totally know exactly what's going on with you, not just neck and back related, but, oh, you have gut symptoms? Okay, if we're not testing, we're guessing. Mm-hmm. So how to test thoroughly and make sense of that data so that then I can know specifically what do we need to do from a food standpoint. What nutrients might your body be lacking? Because most chronic diseases are nutrient deficient diseases. So how do we feed your body more of that? So it's evolved. That's been probably the last decade of my practice. And it's been amazing because I get to help so many more people in the meaningful way that I was looking for of what was done with me when I was a kid.
So Kelly, as you've developed this approach to healthcare, mm-hmm. you've had to deal with a system that feels very differently about what you do. Talk about the system.
The system. Okay, first off, I don't blame doctors for much of anything. I genuinely believe most doctors go to school to become a doctor to help people. Mm-hmm. But with what I was a victim of, if you will, as a kid, to then now seeing what my patients are dealing with and knowing how I can use the tools we have at our availability very differently and the limitations that come from that system, like very much so can see the error of the way of the system. And it's not the doctor's fault, they're just stuck in a broken system. Mm-hmm. So, for example, I brought up lab testing. Medical doctors are allowed to do the same type of testing that I am, but because of how overarching insurance has become in this country, because it didn't start this way, those medical doctors have to be able to justify the tests that they're ordering to insurance, which the way that they do that is you already have to be sick or having symptoms of something for them to investigate. Now, I know that they then can just order symptom-based tests, which again is not going to show us necessarily where the cause of the problem is. Mm-hmm. And an analogy I give my patients is if you've walked into a room before and you saw a stain on the ceiling, how much sense would it make just to paint over the stain? Yeah. Which, when you go and you see your doctor, because of the system they're stuck in, that's what they're being forced to do. Mm-hmm. So they just manage symptoms by painting over the stain. But that's all that they can do because of the restrictions that insurance puts on them. So I am not in that system. I don't have to justify anything that I'm doing. I have access to all the labs just like they do, but we get to test whatever we want to, which is what allows us to be more investigational. Mm-hmm. So that we can peel back the layers of the ceiling and actually figure out where the leak is coming from. Mm-hmm. The other thing that's really fascinating about kind of the evolution of this whole medical system is primary care docs used to be able to do so much more. Like so much more. And now they're just like the gatekeeper, and then they refer you to whomever you need to see. So if you come to them and you're having, chest pain problems, they've got to send you to the cardiologist. Or if you're having joint issues, you're going to go see the rheumatologist. Or if it's hormone problems, you're going to see the endocrinologist. So they literally are just like the traffic controller, and they distribute where you're supposed to go. And then when you go see the specialist, now that specialist has to stay in their lane. So if you see the cardiologist, they can only run tests that are related to the heart. So all they're ever doing is looking at you compartmentalized. Mm-hmm. And that's what our system has become. It's all compartmentalized. And when you question why, like if the goal is to do the good for the patient, Why do we have a system that is keeping anybody from being able to do that? And that's where the real gross side of things comes from. And again, not necessarily doctor fault, but system fault. There is big money. You know, I don't know how to fix our broken system. I would say it needs to be nonprofit. I would say socialized healthcare doesn't do any better at all. You know, knowing very intimately what Canada's medical system looks like, it's a joke. Like, it's not free either. Like, huge taxation, and then you're still paying every month up there. But down here, medical school changed. Doctors used to do medicine the way that I did. But go back to the history in the early 1900s and some unnamed characters that are still very high up there and helping, you know, make decisions. Things changed, and all of the medical curriculum was rewritten to now, like, when a medical doctor goes to school, they learn how to manage symptoms by prescribing drugs or surgeries. And when you see the profits tied behind the scenes, it makes a lot more sense. You know, I was sharing with you earlier, there's this little comic cartoon illustration that's out there that it's a professor at medical school standing in front of a chalkboard, and it said, like, the bottom caption is the first day of medical school, and on the chalkboard it's written, "A patient cured is a customer lost." And then you start looking at the money. It is a multi-trillion-dollar industry in the US. I don't remember when they changed it, but did you realize we're one of the only countries in the entire world that allows pharma to directly advertise to the consumer?
No. Well, I did know that because I started my career in pharmaceutical sales back when that was starting. And I was part of the launch of the new cholesterol medications.
Oh,
So Pravachol.
Yeah.
I was part of that launch. And I remember being at the launch event. It was through Bristol Myers Squibb. And it was at the big Hilton Hyatt down in San Francisco, downtown San Francisco. They brought in the Stanford Marching Band. They brought in Huey Lewis and the News. And this was for all the pharmaceutical reps.
yeah.
And I'm sitting there and I hear this 20-year-old starry-eyed kid like, wow, this is crazy. This is so cool. And then I'm thinking, wait a minute, they have to pay for all of this. Wait a minute, they pay for it with the money that they make off the drugs. Ooh, this is kind of weird. And then you're trained in how to talk about the studies, which are funded by Bristol Myers Squibb or whatever pharmaceutical company it is. And you have a very strict script that you have to follow. And that's all you're allowed to say in the doctor's office. And then you give them a ticket to go to a really cool event at a fancy restaurant. Now, I don't think they let them do this as much anymore. But we would fill up the Winter Park ski train with doctors and take them up and wine and dine them.
Yeah.
And the whole time I'm thinking, this just doesn't feel right. And ended up getting out of the business. Went from drugs to dogs with Camp Bow Wow.
Much better.
Yeah, but it opened my eyes to how much money is flowing in that world.
Yep.
And then we all saw it with COVID. I mean,
gosh. Yeah.
the incentives to not use ivermectin and hydrochloroquine. I can't say it.
Hydroxychloroquine.
Hydroxychloroquine. See, I still can't say it.
HCQ.
HCQ. Everybody kind of, not everybody, a lot of people sensed that something was weird.
Well, yeah.
And the incentives were all wrong. And I just, that's part of what led me to go engage with you and have you as my partner in my healthcare. And it's just totally changed the way I look at things and how I deal with my health and feel so much better. But
piggybacking off of COVID and the amount of money made, to pick on Pfizer, because, you know, they've kind of been the star of the show. Prior to the rollout of what they rolled out in 21, they had only net grossed $40 billion. And by the end of, it was either 21 or 2022, don't quote me completely, but they were up to 90 billion. And so it's really difficult to know, a doctor takes an oath to do no harm and to do the best for the patient. And then you hear the huge amount of profits that are being made off of people's health. And I don't know if you've noticed it, but there's a lot of things happening that are negative within health ever since all of that came about. And I've seen a lot more cancers and infertility and, of course, blood clots and strokes and cardiovascular related issues. And now I'm seeing a wave of more genetic disorders in babies. And there's a common denominator in there. And so when you're you're aware at a deeper level maybe than the average, person is, and you're outside of the system, you're not tied to the system, and you can watch from an outside, like 30,000 foot view. It just reiterates back to why I became a chiropractor in the first place. It's a very broken system. To me, it's all about profit. It's a business first. It's not about taking care of people. I did a presentation a few years back, and I had looked up what was our life expectancy at that point in time. Now, of course, the world's changing rapidly, but at the time, we were one of the wealthiest countries. We're the most medically advanced country, and we were only ranked 38th for life expectancy.
Wow, you're kidding.
No, but it's worse. I just looked it up a couple of months ago. We're at 47th.
I have seen the data that our life expectancy has gone down quite a bit here. Part of me thinks it's related to mental health and the suicide rates.
Well, there's several variables, of course, that have changed ever since the lockdowns, and mental health has definitely gone up, and we've seen suicide go up, but we've also thousands of percents higher, hundreds of percents higher of different medical conditions that we didn't have either before. But there's more in it, and the system is bigger than just the insurance and pharmaceutical. So back to the pharmaceutical advertising, I researched to clarify, I felt like we were the only country. Turns out New Zealand also allows direct consumer advertising. But I know in the United States, it's a multi-billion-dollar industry. And then I also know that America consumes about 2/3 of the world's medication.
Oh, wow.
And then if we bring in the FDA, because it's if we're the most medically advanced, why are we deteriorating so quickly? And there's seeming to be more knowingness that our food quality here is very different, especially when you compare it to Europe. So, for example, we have a banned substance list that the FDA had put together. It hasn't been updated since the 60s or the 70s, and I believe there's only about 30 items on it. When you look at the cosmetic side of that, there's only about 11 items that are banned in our cosmetics. Now, if you go over to Europe and you look at their equivalent of their FDA, in cosmetics alone, there's almost 2,500 unique chemicals and ingredients that are not allowed in their products. They don't even allow genetic modified organisms there. So I have patients here, so many people have issues with gluten, right? And I've had many people travel to Europe that were intolerant or had a sensitivity, that they're fine eating all of the gluten-containing products, like the pastries and the pastas and all that. No issues. And I think there's been enough people who have had that experience that now some of my patients that have celiac felt brave enough to try, because they have very severe reactions. They don't even have problems. So Europe uses an entirely different wheat, but they've banned all the GMOs. And we believe here, part of it is we're having so much more exposure to pesticides as a result, that's part of it. And I just saw not long ago, Italy is one of the first countries to ban all synthetic foods. In our food supply, we allow dyes, artificial dyes. They're banned in Europe. If you put them in a food or a product in Europe, you have to have the equivalent of a Surgeon General's warning, because they're so detrimental to our health. So not only are we just managing symptoms, but we're slowly poisoning people with what we're allowing them to consume here, because we don't have a group that's more willing to protect us. So I think that's also part of why we are continuing to, be derailed in our ability to be healthier. We should be healthier for one of the wealthiest and one of the most medically advanced. It's just a very broken system.
So that's a good shift to what do we as consumers do? How do we get out of the system or disengage from the system and find good people that can help us? Yeah. You're one of them, and I would encourage people to talk to you and go visit your website. But Kelly, what do we do?
So I think the first step is to realize we were so conditioned over the last several decades that if it's not something covered by insurance, it's too expensive, or I'm just going to use my insurance because I pay a huge premium every month. So insurance never used to cover everything. It used to literally just be for a crisis standpoint. And I don't have traditional health insurance. I have a Christian program that literally is just crisis coverage. So part of it is understanding like the mental shift. If you're going to play in their system, it's better to play by their rules, which is where insurance makes sense, because it is more cost effective, even though it's dramatic. So quick example. Years ago, I was getting a toy out of the packaging for my child, and the knife slipped and I managed to cut myself. Like, so many parents have these types of stories, but I needed stitches. So I ran to the hospital, not thinking much about where I was going, because, you know, my insurance changed. So my hospital had changed, but I went to the hospital, got 3 stitches, then I was out of there. Well, you know, you have to wait 2 to 3 months or so to find out how much you're going to be billed and, you know, what was covered and the whole 9 yards. So I'd already paid the doctor who stitched me up $600. And then I got an ER bill for $3,500. Like, I had 3 stinking stitches, and I didn't have bad insurance back then. So I called up the hospital billing department, and like, can you, like, is there an itemized receipt to explain where the $3,500 came from? And the lady's like, nope, that's just what it is. I'm like, I'm not gonna pay that. I was hardly even in your ER. We didn't use hardly any supplies. Like, this is just not justifiable. This is outrageous. And she's like, oh, no worries. You know, we'll just treat you as if you were uninsured. Like, first of all, I didn't know you could do that. And second of all, what does that mean? And she's like, well, that just means your total will be like $492.
Wow.
And my jaw dropped. I had been out of the system for so long, and then going through chiropractic in very, 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 very beginning of my practice, we took insurance, but we were always out of network. And we quickly stopped it because it was a nightmare. We'd call to get somebody's benefits, and they'd be like, well, first of all, we can't quote you that these are exactly their benefits, but here's what they are. Oh, whatever. And then, of course, you tell the patient what it is, you collect according to what insurance told you, and then you find out 3 months later that, oh, here's what insurance told you it was going to be, but instead this is all they're going to pay, and now the patient owes this much more. And it was horrifying to us to have to go back to our patients to tell them, like, sorry, you owe us more money. So we opted out of that system. And what I had learned in the very beginning is you can't have what they consider a dual fee schedule. So I was allowed to have a little bit higher percent fee for my insurance when I bill out particular codes, because there's a lot more paperwork that goes into it and there's more time involved in it. So it was justifiable, but you couldn't go more than 10%. And so here I am sitting there on the phone with this gal who's like, you only owe $492. Now, that is not only 10%. Like, what they're doing is illegal based off of what we're taught and how we have to operate. So through this evolution of figuring out how do I identify exactly where the cause of the problem is, I also needed to figure out how do I not have to use insurance because we're not taking it in our office. And along the same journey with running into Dr. Merkel, I learned that we actually could just go straight to the labs. So I'm not the only doctor in this. We're part of one of the largest private co-ops that exists with LabCorp. We have it with other labs as well, but I get the best, like, I call it true pricing. You can call it cash pricing if you want to, but it's, if you go directly to the lab, here's all it's going to run you. So for example, like when I do my baseline testing, foundation, you know, evaluating all the organ systems, and there's a bunch of other stuff that goes in there so you can truly understand what's going on with all of you instead of just looking at you, you know, through a compartment. If you ran that with insurance, first of all, they're not going to cover all of it because it's not justifiable. So what I've seen come back is anywhere from $6,000 to $8,000. When I know for me personally, my rate for my patient is like $500. So it's nothing in comparison. So what I would suggest is there are concierge medical doctors that are trying to remove themselves from the system. And depending on who they are, their rates are going to be different. They still are tied to the medical system, but they're not like owned by hospitals. Most of them are anymore. But those of us that are outside and do more of the alternative forms of medicine have opted out of the whole insurance game as well. And so we get more affordable pricing. And that mind shift swap is, maybe you just go back to an insurance that's crisis coverage. If you really want to take charge of your health and go back to having true health, taking care of the underlying cause of the problem, if you stay in their system, it's never going to get addressed. And all you're going to do is continue to be more and more medicated, and eventually get more and more sick, and potentially have something catastrophic happen, because that's how that system works. When I swapped what I was doing, whatever extra I would use for a premium, I created like my own health savings account, and it just goes towards how I would actually prefer to spend my money for my health.
Sure.
There's so much more for prevention long term, like the payout on that is huge versus just managing until something big happens. And I mean, my grandparents spent their whole entire life working for retirement, and then my grandfather had a massive stroke that he should have died from, but he was healthy enough that he didn't, and they spent all of their retirement taking care of him. So it's just understanding we have to swap how we view things. Like, insurance is fine to have if you end up with, you know, a car accident and you've punctured a lung. That's good crisis coverage, and, you know, good medicine. Like, they're very phenomenal at getting you back out of a crisis. But for everything else, you just save the extra and use it in cash to pay for the alternatives. That kind of help answer the question.
Yeah, and I think it's gonna need to be led by employers too. Employers are gonna have to take that jump and say, we're gonna do major medical for you, and then we're gonna set you up a health savings account.
Yeah.
We're gonna get you, you know, negotiated pricing for things. But that's a whole nother conversation about why employers got tangled into this whole mess. But Kelly, what, as a parent, how can we teach our kids differently, or do you have some resources or places to teach our kids differently about how to handle their health?
That's such a good question, because when you look at the food that's created for our kids, like just going back to the dyes, the food that is all geared towards children have the most amount of dyes in them.
Oh, wow. That's terrible.
You know, so it's, my niece, I love her dearly. She's one of the pickiest eaters I've ever met. And this is a constant battle. But part of it, I think, is more coming back to parenting and leading by example, you know, and understanding that when we eat outside of our home, like if we stop for fast food or we go to restaurants, we have zero control over what we're actually eating. And we may think we're getting healthier options, but it's bigger than what does it actually look like. Because, I mean, there have been commercials before of like, you're not just what you eat, you're what your food eats also, you know, or how it's grown. So understanding that we use going out to eat as more of like it's a treat. We don't do it regularly. But as a parent too, you have to figure out, well, how can I put healthy meals, you know, or first, how do I get healthy food in the house? And then some of it's, if you can start when the kids are younger, it's so much easier because it's like, this is all that's in the house. So here's what we have options.
Until they go to their friend's house.
I know.
Or the movie theater, or the mall, or that's the hard part.
And they get into high school and they can leave campus. And so I've said to my child from a very young age, like, sugar is poison for your brain. And, you know, these are poison for your brain. And he very much so is liking to push back as well. But the good news is, in order to be healthy, you don't have to be perfect all of the time either. We very much so talk about an 80-20 rule. So maybe that's something that can be modeled in the family of, like, you know, through the work week, through the school week, we're eating healthy meals from home, which, you know, parents take some time on the weekends to batch cook. That's what I do, because I have zero time to cook during the week. I just make up a bunch of stuff, and we get used to eating leftovers. We call them planned-overs instead. You know, planned-overs. That way you're eating real food the bulk of the week, and then we can have a little freedom to do some of the things that we know aren't necessarily the best for us on the weekends. Or like when birthdays come up, my kid has some sensitivities too. And in the very beginning, like, you can't eat birthday cake and you can't do pizza, you can't do any of the things, because it does create some challenges. But I support his system, his digestive system when he goes. I just give him some extra digestive enzymes and, like, you go have fun. And then the rest of the time he knows we just eat healthy, and it's what he knows. My niece, the one who likes to give us grief, no kid is ever going to starve themselves. So it's hard because you feel like you're a bad parent. You don't want your kid to starve. You know, my cousins went through this, like, as long as they will eat something, I'm okay with it. But it's starting the bad behaviors when they're young, and they're not getting the nutrients that they need. And we have so many more adult or older life types of disease and illnesses that we're now starting to see in our children, and a lot of it comes from diet. It's one of the most critical variables that there is. So some of it is being able to have tough love, like, well, this is what we're having for dinner, and dinner served from this time to this time. This gets into parenting with love and logic philosophy.
Yeah.
And if you don't want to eat it, well then fine, when you're hungry, or you say you're full when you're hungry, then that's what we're serving you. Again, like, kids will not starve themselves. So it's just being the parent and sticking to, this is what we do because this is what's healthy for us. And I tell Hunter, you can have a dessert, but not until it's the weekend. Like, we don't do desserts on school nights. And then I'd prefer it not be both Friday and Saturday night. Let's pick one.
Yeah.
And then that way there's still freedom that's there. And it doesn't make it so it's so difficult. And then there are so many resources. When people work with me, I help them have healthier alternatives to go to, and like different swaps that aren't going to be as offensive to the body and will still kind of satisfy those palates. Yeah. I'm not the only one who has any of that either. But it's just a matter of, I think, parents deciding that this is what we're doing and it's what's important, and being the example first to help with raising the healthy kids.
Well, it's interesting. We did this whole summer challenge on Unleashed to get kids off screens and outdoors and reading and doing things that we used to do kind of automatically. And now we'll add this into the mix, and parents will probably be like, I can't take it anymore. To your point, you can't be perfect all the time, but even if we can be better, and 50% of the time we're eating healthy and they're off the screens and outside playing, then that's progress.
It's baby steps.
Yeah. And boy, it's tough. It's really hard to parent right now, and with all the obstacles we're facing and the things that are coming at us, whether it's at the grocery store or McDonald's or school. Yeah. Well, Kelly, thank you so much for joining us today. Tell folks how they can find out about your practice and what you're up to.
Well, there's so many ways to do this. If you're most interested on like the whole testing and like what is foundation of health, mytotalbodymastery.com gives you more information there. There's a video on the screen, there's case studies, different testimonies on there. All of our contact information is on there as well.
Well, thank you again. You are such an inspiration, and I strive to be as good of a parent around their health as you are.
I am not perfect. Trust me, I am not at all. Just one day at a time.
Thanks for talking to us a little bit about the system too. Yeah. We're going to do some other interviews too to highlight some people who are doing different things and approaching healthcare differently, because I think it's a really important time in our society and in our healthcare journeys as Americans to learn more and understand what options are. So,
got to take charge.
Well, hello, John, and welcome to the program. We're so excited to have you on and let our Unleashed audience get to know you and your company. You're doing amazing work in helping folks find a new way to take care of themselves. Tell us a bit about how you got here, how you got so passionate about this.
Well, I will do that, and thank you so much for having me on. It's just such an important topic to me, and I feel like it is an important topic for everybody because health is just so important. So the more light we can shine on this, the better. Well, I was in the traditional healthcare system as a primary care doctor. I'm a family medicine doctor. I did the conventional system, which is based on insurance and fee-for-service. Fee-for-service means you get paid by the appointment. And then, of course, everybody knows how insurance goes. You get your card out and you pay your copay, and then the insurance pays their little bit of your appointment, and you move along your merry way. But there's a reason that physicians and primary care physicians in particular are burning out at such an alarming rate. And it is that very system. It's the fact that you have to deal with the insurance companies constantly, and that there's a financial incentive in the fee-for-service world to bring as many patients through the doors per day as you can cram into a schedule. So both of those factors are eliminated by this model, which is called direct primary care. I first heard about it in about 2014. It's a membership model, and it eliminates those two problems. It eliminates insurance paying for primary care, which we feel is a better way to handle it is by a membership method. The financial model is better as a membership than it is for insurance, because this is kind of small potato stuff And insurance, when you look at what it was initially designed for, was to protect people from a large financial hit when it comes to their health. So we believe that you got to use the right tool for the right problem in healthcare, and insurance is vitally important, but it's more for those expensive, catastrophic type expenses like heart attacks, strokes, car accidents, cancer, things like that. So when you eliminate fee for service and you eliminate insurance paying for everything in primary care, everything improves. It improves for the doctors. It improves for the patients. We get way more time with our patients. We get to actually get to know them. We're not sitting there behind our computer screen, glancing up at you periodically to see if you're still there. We actually have a relationship. And that's what people really want, especially from their primary care provider, is somebody who knows them, knows their family, knows if they're prone to sinus infections or what chronic diseases that they're managing on a day-to-day basis. And we really do. We have the opportunity, thank goodness, to get to know our patients really well. And that just adds to the level of care that we can provide. So makes patients happy. And I can tell you from personal experience and then all of my colleagues that there's no way we could go back to the old system. It's just such a more rewarding way of practicing medicine. And it's a lot more like we pictured it when we went into medical school in the first place.
That's fantastic. And, after we met, a few months ago, I signed my family up because I was so impressed with the model and to try something new in the world of healthcare. I have 4 kids. One's old and off my plans, but the other 3 are little. And I just felt like we weren't being served by their pediatric offices, and I wasn't being served necessarily well in the UC health system. So it's been a joy. It's been really nice getting to know our doctor and knowing that all it takes is a phone call and it's a one-on-one conversation. There's not all these middlemen. And we have had a couple instances where we needed care and it just worked beautifully. And it was kind of hard for me to get my head around how this works. So tell my audience how you get signed up for something like this and how it actually works when you do get sick or need health care.
Yeah, absolutely. So basically, since you're a member, it's kind of like, think of it like Netflix of primary care. You have a membership and you can watch as many shows, you can come to as many doctor's appointments as you need. And you don't even have to go to the doctor. That's the other nice thing about it, is with the membership, we can innovate within that space and come up with all kinds of different ways to deliver care. During COVID, you saw the use of telehealth visits skyrocket. Well, we had already been doing that for years in direct primary care, because once again, we don't need you coming through our doors in order to generate revenue for the clinic to keep our doors open. We can do telehealth visits. I just got off this morning of a Zoom call with somebody who was on vacation down in Florida and wound up developing a sinus infection. So we got her taken care of. That's just one example. People can email us. There's a lot of problems that people don't feel comfortable discussing in person, and they'd rather write it out, make sure that they get their words and their feelings down and send it to us. And then we can provide a thoughtful response. Mm-hmm. So there's just different modalities. It doesn't necessarily have to be you physically walking through the door, coming into the clinic to receive care. We can manage your preventive health needs. So things like cancer screenings, cardiovascular health screenings, all of that we can do. Just be like, hey, you're due for your mammogram. We don't need you to come in for another appointment just to get that set up. We already know that you need it. We can order it. It's just a very lean way of practicing medicine and effective way of practicing medicine. So all of those things are included in a direct primary care membership.
Well, and I was just shocked in a good way at how affordable it was or is. So I know the pricing is probably different for different families and different scenarios, but tell folks how it's priced, because I mean, I think it's fantastic, and it's saving us so much money in copays right now.
Well, for an individual, we call them retail customers that just purchase their own membership. A lot of solopreneurs and so forth will do that just because it's such a good option for them. It's about $75 per individual per month. Mm-hmm. That goes down the more people you add to the plan. So we have family pricing, and then our businesses actually get the best deal when it comes to the memberships for their employees. And it's also, I mean, mostly we what I'm talking about here is solopreneurs and small businesses.
Yeah.
And a lot of times they'll pair what we do with a health share, such as Samaritan Health Ministries, for example, or Zion Health is another great one that we love to work with. That covers those cancer, heart attack, car accident type of things, and then they come to us for basically everything else. Primary care can handle a lot when it's optimized the way that direct primary care is able to optimize it. When it comes to larger companies, we're a solution for them too, especially mainly if they have a self-funded insurance plan. And just in case your audience isn't familiar with self-funded, it basically means that their premiums don't go to Blue Cross or United or Aetna or one of the insurance carriers. They go into their own pool of money, the company's own pool of money. And then that way, the company has the control over those dollars to where they can negotiate directly with the service providers like the hospitals and the surgeons and so forth to actually pay what the services are worth and get away from the whole game that the insurance companies and the hospitals play that drives the cost of everything up. So I'd say that's probably the biggest impact. And when you think about the cost of what most people spend on their healthcare per month, primary care is such a small portion of it, even that $75 a month. And for the value that you get out of it compared to the dollars that you just throw away when you're paying your premiums every month that you hardly ever use and goes to a bunch of middlemen, this goes directly to us. So if you're not satisfied with our care, you can hold us accountable by taking your membership away. So it's on us to make sure that we provide a valuable service to you. And we think that those membership rates kind of reflect that. And we don't want to gouge people. We're trying to come up with a real world, practical solution for the masses when it comes to healthcare.
You know, one thing I really liked about our doctor too is that she respects our principles and values, and we had a deep discussion about vaccinations and about freedom in healthcare, and it was all about what mattered to our family and how we looked at things, and it was very respectable, much different than the pediatric office we just left, where they sent me an email saying that I no longer had access to my 14-year-old's medical information because of HIPAA, which wasn't accurate. And it felt like they were shutting me out of my daughter's healthcare with or my involvement with it. And it just seemed that you take a very healthy approach to respecting people's principles and values, especially when we may have differing points of view.
Yeah. Well, I'm glad that you felt that and that you noticed that, because once again, that's the key thing. It's all about the relationship. We don't want to force people to do things that they're not comfortable with. And we want to hear where people are coming from when it comes to those concerns. So like you mentioned vaccines. Well, not all vaccines are created equal. I mean, like a polio vaccine, I mean, is one of the greatest medical interventions that's ever come to light. COVID vaccines for 2-year-olds, not good at all. You know what I mean? So it's those nuances. Not all medicines are created equal. Not all medicines are appropriate for every patient. So when you actually develop that relationship and get to know people's beliefs and preferences, then we can come up mutually with a care plan that benefits everybody.
That seems really rare these days, which is shocking to say that. But when I was on the campaign trail and talking to so many folks about health freedom, it was just heartbreaking to hear how they didn't have that kind of relationship with their doctors or their caregivers. And if they did have a caregiver who wanted to be respectful of it, they weren't always allowed to, depending on the policy. As a regent at the University of Colorado, we helped oversee UC Health and that whole system. And it was almost impossible to get an exemption if you were a healthcare provider and didn't want to take the vaccine, or if you were a patient or a student. It was almost impossible, which didn't seem right to me. But I'm so glad that you're taking a different approach and offering people something that they so yearn right now, which is just transparency, relationship. And it's really confusing right now, the whole world of healthcare and what's right, what's not. And a lot of people have lost trust. So I know you're growing really fast. Is there a big market for this right now? Are you seeing it translate into like growth among patients?
That's the best part, Heidi, and that's why this is so important. I mean, we feel like we do a really good job in this space, but we are just one of a whole army of doctors and new unique insurance options that are fighting back against this behemoth of a system that we have that is so harmful to doctors and the patients that they take care of. The only good thing about that behemoth system is they've gotten so big and bloated and cumbersome that competing with them is really getting kind of easy. So if we can offer a better service with all this stuff that we just talked about, we could help a lot of people and actually fix the entire healthcare system just by out competing it in the free market.
You know, one thing I've learned over the last few years is how government has taken control of our healthcare and our healthcare systems. And even in Colorado, a lot of people don't know that we're moving very rapidly to socialized medicine. And they set up by passing a law a few years ago that they would undercut the pricing of the free markets through government subsidized healthcare to hopefully do away with any insurers. Is that affecting you guys at all, or do you think that's driving more business to you?
I'd say for now, it's driving more business to us. I mean, it depends on what they wind up mandating, and I wouldn't put anything past them, unfortunately. But that's another key thing. That's another reason why this fight is so important to me, is I know just how horrible things could get if the government did get control of healthcare. I mean, we kind of saw glimpses of it during COVID, right? You could essentially declare anything an emergency and do whatever you want. I mean, the CDC did an eviction moratorium for landlords.
Yes.
The governor of New Mexico suspended Second Amendment rights because health emergency, right? So there's so much money and such a huge chunk of the economy and so much power involved in the healthcare system. That's why it's so attractive for the government to get a hold of it. And Medicare for All wouldn't fix anything. It would just be our same bloated, broken system, now just paid by tax dollars in a system that's already set to go insolvent.
Yeah, I mean, I don't think the government does much of anything well right now, and I certainly don't want them in charge of my healthcare. And I tell people to vote with their dollar, and one way they could vote with their dollar is to disengage from the traditional system. Tell us a little bit. This was really interesting when we talked about this, about who the middlemen are in the process, like why healthcare is so expensive and why it's so hard to break apart.
Okay. And there's a whole lot of reasons why, but it's basically the capital that's created by helping people get over illness and maintaining health is very valuable, right? So it's something that people are willing to pay for. But there's this shadowy industry of middlemen that has kind of carved out a niche in the market for themselves. So one of the worst offenders is something called pharmacy benefit managers, or PBMs. This would be like CVS Caremark, Express Scripts, some of those. Those are some of the largest companies in the world, by the way. Basically, they mark drugs up to 10 times what they're worth and then do a fake discount that's less than the amount that they marked it up and then pretend like they're actually helping people. So that's probably the biggest offender. There are the whole way that insurance works and their contracts with the hospital, they don't even base it on the actual value of what service is being provided. They just throw numbers out there and then tack on a bunch of discounts and backdoor deals with one insurance company versus the other. This is why if you ever ask what a surgery is going to cost or any kind of procedure is going to cost, they can't tell you. So those are probably two of the biggest offenders. The same thing happens with durable medical equipment, and just the bloated bureaucratic element of it all makes it so that you can hide under the system essentially and profiteer and gouge patients if you really wanted to. And unfortunately, that happens as well because doctors are partially to blame for the middleman industry as well in some instances. There's a fantastic book that I'd love to recommend to your audience. It's by Dr. Marty McCary. It's called The Price We Pay. And it's all about this. It's all about the middlemen and the burdensome bureaucratic element of the healthcare system. And he does a really good job of breaking down every piece of that. And it's very, very eye-opening and well worth the read.
Well, I do think that it's very, very difficult for people to emotionally abandon the traditional system, right? They've been so ingrained that you have to have insurance, the best insurance possible, and pay for the most premium possible. And if you get sick, pay your copay and trust the system, and they will take care of you. What are a couple bits of advice to help people gain more confidence in breaking from that system? Is it just to find a provider like you that's offering something different and start to get to know them? Or is it, are there some stats you can offer to really wake people up to how effective it is to get out of the system?
Well, you could definitely start by reading that book, The Price We Pay, just because the first thing you got to do is understand your enemy, right? You got to understand what is costing you so much and why you get so little in return. Okay. Once you understand it, then you can be like, okay, well, this plastic little card that I carry in my wallet all the time doesn't really do that much for me. Definitely not worth what I'm paying all these premiums for, right? Well, then you can start looking for what you actually do need, which could be a membership-based, value-based primary care, like direct primary care, added on to a high deductible catastrophic plan, a health share, all kinds of options out there. Usually, almost always, there's an option that will suit your needs, that will be better for you and better for your checkbook.
Okay, so you obviously have a location in Lone Tree, which is where I use, and then you have one in Colorado Springs. Where else are you expanding to right now?
We actually have two in Colorado Springs now. So we've got one kind of on the north side and then one down by the Broadmoor. So we have those three locations. Having done these three clinics in the last 2 years, I think I'm done opening clinics for a little while. So what we're going to transition to is actually helping people manage the business side of their practices, because most doctors aren't all that great at that. It's been a steep learning curve for myself these last 2.5 years. So we're going to lower the threshold for people to be able to take the leap from a doctor standpoint and in to direct primary care, and then hopefully help promote it and get more people into it, because we've learned so much, fighting this fight over the last couple of years, and we want to be able to help other doctors and other practices thrive within this kind of parallel healthcare economy. So that's what we're transitioning to now. We're still going to keep running our clinics and keep innovating in this space. That's the other great thing about direct primary care, is like each clinic is its own little petri dish of innovation when it comes to healthcare, because people think that we've hit the ceiling when it comes to healthcare innovation. We haven't even scratched the surface. We could get so much better. And this is the kind of environment that allows that to happen. That's probably the coolest thing about it. So that's what we're planning on doing for the foreseeable future.
It made me chuckle. It made me think of Big Hero 6, if you've ever seen that movie.
Oh yeah, love that.
What's the guy's name? I can't remember what his name is, but
are you talking about Baymax, the Michelin Man guy? Yeah.
Baymax, the Michelin guy who kind of just knows when something's wrong with you. I feel like that's the future we're headed toward. I hope they're as cute if they are robots that diagnose. But
I would love to have a Baymax in our clinic. That would be a big draw. You're giving me some good ideas here.
Dr. Dygert, tell people how they can get in touch with you.
You can always get a hold of us through our website. It's pinnacleapc.com. That stands for Pinnacle Advanced Primary Care.com. Our phone number in the Springs is 719-465-1579. From there, we can get you to any of the clinics. And you can always email me at jdygert@pinnacleapc.com.
And it's Dygert.
Yes, I'm sorry. Thank you. It's JDYGERT at
And we'll put that in the
pinnacleapc.com.
links on social media. But so grateful for your time. I know you're really, really busy, but I'm really proud of everything you're doing to transform healthcare. And as a patient now, I just can't say how much better it is and how much more affordable it is. I strongly encourage people to look into this direct patient care model. I think it's the way of the future, and we all need a better way to take care of ourselves, and this is one step we can take towards that.
Absolutely. Well, thank you so much for having me on and shining light on this very important topic.